Hi everyone, just going to give you a brief intro on fussy eating or feeding intervention that we provide. I've got 5 minutes before my next meeting, so I'm in my car. What is fussy eating? Fussy eating or problem feeding is either when we have a child who is most likely young and hasn't developed the oral motor skills correctly to eat, and they might be gagging or choking or simply refusing to eat more complex foods, like meat you have to chew or crunchy apples, things you really have to work with your jaw. Or we have our really fussy eaters who have kind of less than 30 foods, sometimes even less than 10, so they're not getting a good range across the food pyramid. The choices that they're making during the day are perhaps all white or all purees or all soft dissolvable kind of food that melts in your mouth and it's easy to swallow. What can cause fussy eating? It can just be a personality thing. I was a fussy child. I'm still a little bit of a fussy adult. It can also be that a child has had a bad choking experience when they're young. They haven't gone through the normal developmental pathway of the eating as well. Like if they've skipped mashes and purees and they've gone straight to really solid food, sometimes that means the muscles in the mouth don't develop properly or the tongue doesn't develop properly to be able to move that food around efficiently and get it to a state where it's easy and safe to swallow. Other things can be sensory issues, and also family lifestyle. If you don't like lots of things, there is a big chance your children won't like lots of things, and they would have watched you respond to food in that way, and they might be modelling that. So that's can be a lot of reasons. What we want to do about fussy eating, first off, is if you're really concerned, you talk to your GP, you try get a referral through to your local DHB so you can see a dietitian to actually check your child's growth, check your child's nutritional rates and what they're eating, and then potentially get a referral to a speech language therapist or an occupational therapist, or you come see us. But I would like for people to have seen their GP first and check that there's no immediate health issues that need addressing. And often we do referrals through to dietitians if people come through to us first. What you can do then is make sure you reduce the demands, reduce the pressure to eat, reduce the anxiety and the stress around meal times. What happens when a child is anxious or feeling forced to eat is their adrenaline goes up, right? And adrenaline suppresses the appetite. So the more stress there is around the mealtime, the more arguing and you will eat this and trying to force feed, the less likely your child is going to develop a healthy relationship with food and feel safe trying new food. Our philosophy is based on the SOS approach to feeding, which is a complex course, but the tenets behind that, or the philosophies behind that, is the child needs to go through the normal developmental phases of eating to be able to develop the skills, the tolerance to different sensations, and learn that food is a good thing. Food is fun, food can be safe, food can be enjoyable. So keep offering food, keep offering a safe food with every meal, a food that a child can eat, and also offer different foods without the pressure to eat them. So try and encourage them to explore that food, but don't put that pressure on because it's not going to help. If you are really concerned, then please do call us. Happy to have a chat to see if we can be of any help, or even just advise what would be most worthwhile pathway for you, whether you need to really push for the DHB or GP, or if it's all right to just come straight through to us, or your local feeding service at your hospital if you're eligible. Hope that has been useful. We do have a feeding education program which goes a lot more in depth, that families can partake in, and we also feed into our feeding therapy sessions. We have one person with the parent often and one person with the child engaging in that feeding therapy. So hopefully we have answered some questions. Looking forward to hearing from some of you, and good luck with your meal times.